It's a different ballgame for the Department of Public Health, as officials are not only watching the number of tuberculosis cases reported, but also those who have contracted sexually transmitted diseases and the human immunodeficiency virus. STD HIV Prevention Program Manager Bernie Schumann says she has noticed a 20% increase in gonorrhea and syphilis cases and expresses concern that people with STDs are still having unprotected sex.
What we have seen are dual infections of chlamydia and gonorrhea, or syphilis and gonorrhea and chlamydia. And so those are really important markers, because you want to make sure that those sexual partners are also treated.
Schumann also says her clinic is collaborating with the Tuberculosis Control Program to prevent those with compromised immune systems from contracting tuberculosis. Meantime, CDC Coordinator Cecilia Arciaga says public health has been in constant contact with Chu'uk officials to make sure their TB outbreak doesn't spread elsewhere.
Our director has been openly communicating with actually the FSM Council and the director of I think health or skilling in FSM, and we're doing everything we can to help them out as well.
Although Guam may not have any reported multi-drug resistant TB cases, Arciaga explains between 2006 and 2007, the number of tuberculosis cases has jumped nearly 70%.
From 2006 to 2007, actually our rates increased by 70%.
What kind of numbers is that?
That's actually a 70% increase, and our incidence rate is actually 53 per 100,000 population for Guam. And that's about, I would say, 4 to 5 times more of Hawaii as a whole, and about 12 times more of the U.S.
Arciaga and Schumann agree the STD HIV clinic and the TB control program need to continue working closely to maintain control over these diseases, and are asking those who think they have any symptoms associated with STDs, HIV, or TB to contact public health immediately.
This co-coordinated effort is to ensure that the TB among HIV patients are handled appropriately.
Josh Tikenko, Pacific News Center.